Good morning. My name is Syed, and these are my colleagues Alyssa, Shravan, and Ashley. And allow me to introduce to you the TEACH technique, tackling education about COVID-19 and heart health. Today we'll be discussing COVID-19 and the ACE2 receptor, heart failure and cardiomyopathy, atrial fibrillation, and disparities in underlying conditions, as well as our prevention first technique and our solution, microgreens. Now, allow me to pass it on to my colleague Ashley, who will be discussing COVID-19 and the ACE2 receptor.
Thank you, Syed. COVID-19 is a single-stranded RNA viral disease caused by the SARS-CoV-2 coronavirus, and it can lead to very damaging effects on the heart. How, you might ask? Well, first, you have to take a look at the angiotensin-converting enzyme 2 receptor, also known as the ACE2 receptor. The ACE2 receptor has many important roles, such as maintaining blood pressure homeostasis, lowering inflammation, and guiding wound healing processes by counteracting the effects of angiotensin-converting enzyme, also known as ACE. However, due to the research done in the past year, it was discovered that COVID-19 binds to this receptor in order to gain entrance into the cell, and this binding causes the inhibition of the ACE2 receptor to regulate ACE. So, what does this mean for the heart? Well, the body's natural immune reaction to a viral disease like COVID-19 is an inflammatory response. And since angiotensin-converting enzyme is now unregulated, these levels of inflammation will increase without stopping, which will cause heart damage. Such inflammation can be seen in the heart muscle, as well as the lining of the blood vessels. If inflamed, chances of blood clot formation within these vessels increases, and subsequently leads to increased risk of heart attacks and strokes, as well as lowered blood oxygen levels. If blood oxygen levels become too low, the heart muscle will no longer receive adequate amount of oxygen from the lungs, and the heart muscle will continue to weaken. All in all, due to its effects on the ACE2 receptor, COVID-19 can lead to many heart complications that all result in weakened and inflamed heart muscle known as myocarditis. Prolonged myocarditis can lead to further damaging effects, such as myocardial infarctions, cardiomyopathy, AFib, and heart failure, which will now be discussed by my colleague Shravan.
Thank you, Ashley. Close to 6.2 million adults in the United States have heart failure, and it is estimated that 12.1 million people will have AFib in 2030. From these statistics, it is obvious to see that these cardiovascular epidemics plague our society as a whole. As Ashley mentioned, prolonged myocarditis can lead to cardiomyopathy. Cardiomyopathy is defined as a disease of the heart muscle. The types of cardiomyopathy I'll be discussing with you today are dilated and restrictive. Dilated cardiomyopathy is when the heart muscle stretches and becomes thinner as the inside of the chamber enlarges. Restrictive cardiomyopathy is when the heart's ventricles become stiff due to abnormal tissue, such as scar tissue, replacing the normal heart muscle, which results in the ventricles unable to properly relax and fill with blood. This leads us to heart failure. Heart failure is a chronic progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. There are two types of heart failure, systolic and diastolic. Systolic heart failure, also known as heart failure with a reduced ejection fraction, is when the left ventricle loses its ability to contract normally. The heart is unable to pump with enough force to supply the body with sufficient blood, and the left ventricle weakens. Diastolic heart failure, also known as heart failure with a preserved ejection fraction, is caused by inadequate dilation of the left ventricle during diastole. The heart muscle, this results in the left ventricle stiffening and bulking up. These patients are characterized by frequent hospitalizations and high mortality rates, similar to those found in systolic heart failure. Now, let's talk about atrial fibrillation. Looking over here at this picture, the EKG shows a fast and irregular heart rate that is not in sinus rhythm. Based on my calculations, it is going at about 150 to 200 beats per minute. Your heart cannot handle that. It is going way too fast, which will lead to tachycardia-induced cardiomyopathy. Atrial fibrillation is an irregular arrhythmia wherein the atria quivers rapidly out of coordination, resulting in the ineffective movement of blood. If the heart does not pump blood properly, blood can pool and form abnormal clots within the heart, and if these clots travel to the brain, it can cause a stroke. As you can see, these heart conditions are very dangerous and can be very severe if left untreated. Now, these heart conditions can be even more severe in some ethnic groups over others. Now, I'm going to pass it on to my colleague Alyssa here to talk more about the prevalence of these heart conditions in different ethnic communities.
Thank you, Shravan. AFib and other heart issues such as heart disease disproportionately affect minority communities. Reports from 2018 show that African Americans were 30% more likely to die from heart disease than their non-Hispanic white counterparts. Similarly, when it comes to COVID-19, African and Latino Americans were around 3 times more likely to contract COVID-19. They had higher rates of hospitalization and death. This is partly due to African Americans having higher rates of hypertension, diabetes, and other underlying conditions that can also lead to heart issues as well. Although this issue is not completely genetic, years of systemic inequality in the United States have been exacerbated by the pandemic. Minorities have had higher transmission risks because they're more likely to be considered essential workers, live in multi-generational households, and have inadequate access to health care. African Americans still only own around 1/10 of the wealth of white Americans, and minorities are much more likely to experience multidimensional poverty than their white peers. 17.7% of the United States qualify as living in a food desert, or an urban area where it's difficult to purchase nutritious, affordable foods. Minorities disproportionately represent that community. For some of these communities, their only viable options are overprocessed snacks and fast food, leading to high cholesterol, hypertension, and diabetes, damaging their blood vessels, increasing their risk for heart disease and COVID-19 as well. That is why, for our solution, we are looking to impact and educate these low-income minority areas to help lower their risk. Now I'll pass it off to my colleague Syed to discuss our prevention-first approach.
Nowadays, treatment is the preferred option for any heart-related issues. But by the time we tend to these issues, it's often too late. This is why here at Teach, we decided to focus on prevention first. Our first preventative action would be COVID-19 screening for patients with heart issues. In this way, we can help find the issues that is making the patient's health worsen. Next, we're going to create awareness campaigns within the communities by handing out flyers, pamphlets, and educational videos. Along with this, we're going to help promote exercise and a healthy way of eating. By doing this, the population in these communities, like Alyssa had mentioned, will gradually become healthier and healthier. Next, within these underprivileged communities, we're also going to have free clinics. Since cost is a huge barrier for individuals living in these communities, free clinics will help them get tested for heart issues and COVID-19. Lastly, we're going to expand the SCARF AED program. This way, anyone suffering a sudden cardiac arrest death will no longer have to suffer a sudden cardiac arrest death. Now, I'll pass on to my colleague Ashley, who will be discussing our innovative solution, microgreens.
Yes, so we wanted to fit alongside this prevention-first approach as well as continue to target these low-income communities, so that's why we decided to focus on microgreens. Microgreens are newly sprouted plants without roots that can be harvested between 5 to 14 days after seeding. Due to their short growth period, they tend towards aromatic flavors and very concentrated and densely packed nutrients. A research team for the U.S. Department of Agriculture actually found that microgreens can contain up to 40 times more nutrients than their mature leaf counterparts. These vital nutrients are highly beneficial for cardiac health. For example, brassica microgreens like broccoli, kale, and radish have high levels of potassium, which helps with depolarization, allowing your heart to squeeze out blood to the rest of the body. Red garnet amaranth microgreens and cilantro microgreens have high concentrations of vitamin K, which helps make various proteins that are essential for blood clotting. And lastly, almost every type of microgreens contain polyphenols, which are powerful antioxidants that reduce the inflammatory responses within the heart, which is a common complication for COVID-19 patients as discussed earlier. Specifically, red cabbage microgreens have cholesterol-lowering polyphenols, which helps reduce low-density lipoprotein cholesterol and lowers risk for heart disease.
Not only do microgreens help lower LDL cholesterol, which is extremely prevalent in minority communities, they're also a wonderful option for these low-income areas because of their price. They really only cost about $4 per 12 ounces, which is the recommended serving size for a family of 4. They can be grown any time of the year, no matter the weather, making it sustainable for all types of climates, and they can be grown anywhere, whether that be your garden or your kitchen counter. We want to work on providing our microgreen solution to not only disadvantaged communities in the United States, but to the rest of the world as well. And that means taking steps to partner with nonprofit organizations like SCARF, but also Charity Seeds and the Sustainable Food Trust to educate and impact these low-income minority areas on the importance of maintaining a healthy diet that includes ingredients that will maintain good heart health. And if our first initiative is successful, we plan on expanding it to include other ingredients as well, such as turmeric, curcumin, and flax seeds, which are all ingredients that can be easily incorporated into any diet.
If you take a look over here, these are the microgreens that we grew ourselves to show just how easy it is for anyone to grow, even those with limited gardening knowledge. As you can see, COVID-19 has detrimental effects on cardiac health, and our team is working on combating these issues by providing a universal solution. At SCARF, we see one, do one, and now it is our turn to teach one. Thank you.